Robert, very nice to see you. And you said I could call you Bob. I appreciate that.
It's nice to be here. Thanks for having me.
Okay. Now, you have done just extraordinary work in the field of being a journalist and reporting on medicine and psychiatry in particular. You've won awards. The last one that of great note was, I think, in 2010 when you got the highest award for investigative journalism from the, let me see, Investigative Reporters and Editors Book Award. Is that right?
That's correct, which is a nice award because it's your peers handing it out, so it's a nice
Yeah.
thing.
Well, I wanted to invite you to be a presenter because you have such a wonderful perspective. Not that you have the brightest, most hopeful information to give and share, but that you have perspective that we all need to know about in terms of what's going on with the mental health care system in the United States today. So would you just tell us where you're located and what you're doing these days to introduce yourself?
Sure. I'm located in Cambridge, Massachusetts, right next to Boston. And what I'm doing these days really is a couple of things. One, I'm still speaking a lot about anatomy of an epidemic, giving talks, including grand rounds talks, and increasingly overseas. So I think I've been to Europe maybe 6, 7 times in the last 5, 6 months, maybe given 40 talks in Europe. And the only thing I think that's interesting is because it shows that these questions are not unique to the United States. They're basically common to every society that has adopted this drug-based paradigm of care. And they're wondering what's going on. So that's one thing I'm doing. The second thing I'm doing is I started this website called madinamerica.com. We have maybe 60, 70 people writing for it now. And we have news updates and we have videos on there. And it does take some time to run that enterprise. And I'm happy to say we're getting close to 100,000 visitors per month, which is, in terms of building a community of people who want to think about mental health and how to do it better, that's basically the purpose of Mad in America. And then the third thing I'm doing is 2 years ago I was a fellow at Harvard University, their Safra Center for Ethics, and it's part of an initiative to investigate institutional corruption. So how do institutions that are supposed to serve a public good, how do they go awry? What causes them to go awry? What's the social injury? And so some people are looking at Congress, some people are looking at Wall Street and other institutions. They asked me to look at organized psychiatry in the United States, the American Psychiatric Association, and basically academic psychiatry. So I'm co-writing really an academic book that looks at the behavior of academic psychiatry in the APA over the past 30 years, are the things that cause that institution to become corrupt, et cetera, et cetera. So that's what I'm doing. And hopefully that book will be done in 3 to 4 months.
Thank you. Well, I just wanted to say that before we did this interview, I took a quick look at Mad in America, and I saw that you had a roster of articles you're writing for that, which is a fabulous thing you're giving the public, Robert, because you are so skilled and you have so much information.
I try to write every now and then on Mad in America, and especially in response to certain news reports, research reports. At the same time, I do see it as a forum for other people to speak, and we have a lot of different people writing out. We have psychiatrists, psychologists, social workers, and a lot of people with lived experience. So it's a mix of voices there.
Great. Well, I'm going to say goodbye for now, and then we'll do a longer interview soon. Thank you so much for being with us.
Great. Thanks for having me.